In fact, this is the second type of patient. In fact, do we look like you have some patients? You look like he has neutral teeth. But in fact, his bone shape shows a type 2 mismatch, right? In a situation like this, we prefer his pivot is forward. His posterior fulcrum was anterior. The fulcrum of the posterior teeth is moved forward to make it easier to fall. Lowering his face height doesn't make his chin come out a little bit. Can there be a good facial shape improvement? If you look at it from this perspective, we must be pulling the back tooth. It's easier to lower our face height, pivot forward, right? So in this situation, we may consider 4 or 5 because number 5, because in fact, the mandibular support is me. And for example, if you pull 4 fours out of both the upper and lower jaws, you have nothing to support. Normal patients, you go tip to tip. I don't know if you have such a case. You have nothing left. You are normally a patient with 4 fours because the maxillary anchorage is easy to lose. The upper jaw is very easy to lose anchorage. You could do that and you'd lose the maxillary anchorage. After losing it, you will find that, hey, I'm tip to tip. I have to add a second category of money, right? So from that perspective, I just mentioned the first point, right? Let me now turn to my second point. In terms of quality resistance control, in terms of quality control, the upper jaw is also easier to lose. The lower jaw is more resistant to foot because the 6 and 7 flat root cortices are relatively dense, so they are also easier to control and resist. That's actually a mismatch of our second kind. We'd rather have the posterior mandibular teeth moved in a little more, right? Maxillary posterior teeth are best not to go forward. You can have a neutral relationship. So from this situation, we're definitely hoping that the posterior mandibular teeth go further forward, right? That's right. So maybe it's in our medical records because they are all second class. There are more than 4 and 5. Maybe we have it too. Just pull for 4s, right? What kind of person pulls for 4s? It's just that his front teeth are so crowded. It's possible that I pull 2 4s. There's no room in a row. Then for a patient like you must be lined up and pulled 4 times, right? Is this the case? Well, so it still depends on the case. But there must be a reason we pull this way. There are other patients. Well, it is indeed possible that if you pull 5, it will be easier to line up neatly than if you pull 4, especially for patients with invisible correction. Well, you can pull 5 patients for invisible correction. Relatively, your front teeth are easier to flatten, easier. Keep it down. So let's talk about it for a few reasons.